Here's a 1988 Detroit Black Journal interview about health disparities in African Americans.
But what's the difference today in picking up that cigarette or picking up that cigarette some 20 years ago when in the movies people were smoking and that was the cool thing to do?
And they were dying of cancer of the lung at that time too.
I think the advertising, there is a book, I think it's Professor Warner at the University of Michigan has come out with a book called The Selling of Smoke, which chronicles the campaigns where in his book, the tobacco industry has targeted minority communities and especially minority women. It has been very successful, and they also have a very good lobby. I think Philip Morris is probably one of your greatest contributors to black colleges. They support the Joffrey Ballet. They support many of your singing groups, provide free concerts. So when one attacks these people, one has a formidable foe.
Let me touch on the point that you made. Back 40, 50 years ago, people were smoking more and people were dying more of lung cancer. But as we found out how to handle these risk factors more and medical technology improved, we've had the non-minority sector of our country take the benefit of that. So what we see now is a widening gap between 5 or 6 major diseases that blacks are dying from that whites are not dying from the same rate. There's a concept in public health called excess deaths. For 1979-81, about 230,000 black folks died before the age of 70. About 59,000 of those persons, if they'd had the same experience as whites had, would not have died.